Okay, nice. Private healthcare plans, an indemnity plan. This is a healthcare insurance plan that reimburses the individual, but they are free to decide. This is the important. Individuals are free to decide whether to seek care from a primary care physician or from a specialist. So here's the example. Here's what really happens. Let's say I have allergies. Okay? My options are to go see my primary care physician. When I say primary care physician, I'm referring to your family doctor. If I go see the family doctor, okay, they might be able to cure it. Because maybe it's a simple allergy. Maybe it's like, I got some dust, okay? Or, they're like, hey, did you buy a new pet? Okay, things that are obvious. But if they can't handle it, okay, they're going to send me to a specialist. Now, the specialist costs more, and this is not a dig on family health care or your family doctor. Okay, family doctors are just cheaper. Okay, and don't get me wrong, I love family doctors. I'm friends with a lot of them, actually a lot more than I thought I'd ever be, because that's the industry that my wife is in at this point. Okay, so in an indemnity plan, I can go see whoever I want. But you pay more for that, because the specialist costs more. And there's people that do this. They look at themselves like, my cuticle, it's broken, I need to go see a plastic surgeon. And they run to the plastic surgeon and it costs more. When really, all they had to do was go to their family doctor. The family doctor would be like, dude, it's a cuticle, get over it, put a little lotion on it, and call it a day. Okay? So understand, the indemnity plan tends to cost more because they're giving you that option to go see whoever you want. Now, let's skip managed just for a moment. We're going to come down to the HMO. Okay? And that's a health maintenance organization. A health maintenance organization works like this. If I get a cold, or if I have that allergy, or again, even if I have that cuticle problem, they make me go to my family doctor first. Because they know most of the things that people panic about, the family doctor can handle. And it's cheaper to send them to that family doctor. Okay? But the positive is, of course, that they can control their costs and that we do see our family doctors more often so that we're seen by the same person more often. Downside, if I really know that it's an allergy issue, I can't just go to my allergist. I have to go see my family doctor. They have to hand me a referral. Okay? And then I can go see my allergist. So again, I'm just giving you the pluses and minuses because when you do this assignment, when you write your argumentative essay, I want you to look at all of these attributes to figure out what you think the best plan is. And I'm not here to tell you which way the best plan is, folks. That's a personal thing. I want to hear from you guys. Because there's no right or wrong. It's just what you think the best is for our country. So again, the HMO makes you go to your primary care physician first. Now, managed healthcare is a little special. The largest managed healthcare organization in our country is Kaiser Permanente, or Kaiser. And this is how Kaiser works. Kaiser owns the hospitals, the primary care, and all the specialists. They own all this stuff. So when you have Kaiser, you go to a Kaiser doctor. And if that Kaiser doctor says you need to see a specialist, they send you to, let's say it's an allergist, they send you to a Kaiser allergist. And then what happens, you go to that Kaiser allergist and they say, no, you really have black lung. You need to go see the Kaiser surgeon immediately. And the Kaiser surgeon takes care of you at the Kaiser hospital and they cut you open with a Kaiser knife. Because they control everything. Now the nice thing is that they talk to each other. They're a unified system. So they communicate well. Okay? Some of the negatives are you don't have as many options in doctors because you are stuck going to their particular doctors. Okay? So, again, there are pluses and minuses to all of these plans. I just want you to be aware of them as we go through this, because your argumentative essay needs to be able to cover these different concepts. Again, no right or wrong, just different. The PPO. This is another one that's offered a lot of times by employers. Preferred provider. That says that you can go to whatever provider you prefer. Much like the indemnity plan, this allows you to go directly to that specialist if you want to go see that specialist. So if you have to have your cuticle seen by the plastic surgeon, because maybe you're a hand model or something, okay, and you're allowed to do that. You can go right to your specialist. You don't have to go to your family doctor first in a PPO. The PPO tends to cost more because you are given that option to go to that specialist. And we already talked about the cost of specialists can be 2 or 3 times more than the normal, I don't want to say normal, than your standard family practitioner. Okay? They do have discount rates on arrangements with some hospitals, so sometimes you don't pay too much more. And they also have per diem rates with certain hospitals, meaning that if you're in the hospital, you only pay so much per day. Now, goods and bads. You might just pay a certain amount per day, but that means that they may not give you everything that hospital provides, because the hospital knows it's only going to get a certain amount of money no matter what it does. Just again, something to think about. They do have these per diem arrangements. But the PPO, again, not a bad plan, not a good plan, just a plan. It just gives you a little more option, but you do tend to pay a little bit more in premiums. Premiums for healthcare insurance. Employers may offer individual or family coverage. The family coverage is normally a discounted rate. So if it costs you $25 to cover you, it may only cost you an extra $15 to cover your family, maybe. But a lot of times you can get discounts because you can get your entire family under one package. That tends to cost a little less. You can get insurance and quotes online. If your company that you're starting with offers several plans, go on their websites and look at those plans and exactly what they entail. Although most of the time the HR departments of your company or employer will give you that, right? And the last thing is the trade-off between flexibility and premium. If you pay a higher premium, you get more flexibility because you are allowed to choose your provider. If you pay a smaller premium, you may have to go to your family practitioner first.